Hello, I'm Dr. Linda Parker, urologist and educator in healthy aging, and today I want to answer a question many people over 60 ask in private, but rarely hear discussed with clarity. What's a healthy masturbation frequency after 60? My goal is to give you a calm, science-aware, judgment-free answer that respects your dignity, supports your intimate health, and helps you find a routine that truly fits your body, your energy, and your values. No scare tactics, no shaming, and no unrealistic promises. Just practical guidance you can use tonight. Let's start by releasing the heavy myth that gets in the way. For decades, many were told that after a certain age, desire should fade. Self-stimulation is a sign of loneliness, or it somehow uses up energy you ought to save. That story is not just wrong, it's harmful. Your body in later life remains responsive, adaptable, and receptive to gentle, consistent care. Intimate well-being at 60, 70, or 80 is less about performance and more about circulation, comfort, nervous system balance, and a respectful relationship with your body. Masturbation, what I will call self-stimulation, can be a healthy part of that picture for many people. The key is not a single right number for everyone. The key is the fit between frequency, recovery, and how your body actually feels. So what is healthy? The honest answer is a range. For most adults over 60 with typical health, a healthy frequency usually falls somewhere between 0 and 3 times per week, with a meaningful minority comfortable at a bit more or a bit less. That wide range surprises some people. But it makes sense once you consider the variables that really matter. Your cardiovascular fitness and circulation, your pelvic floor tone, your medications, your sleep, your stress level, your hormone profile, your existing prostate or vaginal health, and whether you are dealing with conditions like diabetes, hypertension, or arthritis that influence energy and recovery. Your healthy frequency is the one that leaves you feeling well the next day, clear-headed, comfortable in the pelvis, and emotionally content, not depleted. To understand why the right frequency is so individual, it helps to know what happens in the body. Self-stimulation activates the autonomic nervous system, increases pelvic blood flow, and, if you reach climax, triggers a wave of neuromodulators that produce a sense of release and calm. In later life, those processes can be beneficial because gentle arousal encourages vasodilation, supports tissue oxygenation, and helps maintain the elasticity of intimate tissues. It can also aid sleep in some people by lowering stress hormones. But the same process can be uncomfortable if frequency is mismatched to your current health. Overdoing it when the pelvis is already tense can create lingering sensitivity, irritated skin, or a heavier pelvic floor tone the next day. Underdoing it, if you enjoy it and it supports your comfort, can make the pelvic region feel stagnant, which in some people contributes to a sense of pressure. Balance is the art. Let me give you a simple way to approach frequency without guesswork. Think of it in 3 steps: baseline, feedback, and adjustment. Baseline means you choose a starting rhythm for 2 weeks. If you're currently not sexually active with yourself or a partner, start low, once a week for 2 weeks. If you're already active about once or twice weekly and feel fine, keep that baseline for 2 weeks. Feedback means you pay attention to 4 markers within 24 hours after a session: pelvic comfort while sitting, ease of urination, sleep quality that night, and mood the next morning. If at least 3 of those 4 are stable or improved, your baseline is appropriate. If 2 or more are worse, more pelvic heaviness, disrupted sleep, increased urgency, decreased frequency or shortened stimulation time, and increased lubrication and warm-up. Adjustment means you modify only one variable at a time, either the number of sessions per week or the intensity and duration of each session. That way, you know what produced the change. Now let's talk numbers, because many people want them. If you're 60 to 69, reasonably active, and not dealing with acute pelvic issues, 1 to 3 times per week is a common sweet spot. If you're 70 to 79 with good mobility and you enjoy self-stimulation, once or twice per week often feels sustainable, with a rest day between sessions. If you're 80 or older and in stable health, once every 7 to 10 days is plenty for many, though some remain comfortable at once per week. You don't need to hit these numbers. They're simply landmarks to reduce anxiety and reassure you that you're not too much or too little. What matters is whether your body feels calm and comfortable afterward. A healthy frequency also depends on how you prepare and how you recover. Warm-up matters more in later life than in earlier decades. I recommend a brief 3-part preparation that takes 3 to 5 minutes. First, breath. Inhale through the nose for 4 counts. Exhale through the mouth for 6 counts. 5 rounds total. Second, posture. Recline or lie in a position that lets your abdomen soften and your lower back rest. Tension in the lower back often transfers to the pelvic floor. Third, warmth and lubrication. A warm shower beforehand or a warm compress over the lower abdomen for 5 minutes can improve circulation. Always use a generous, skin-friendly lubricant to reduce friction. Afterward, recovery is simple. A glass of water, a minute of slow breathing, and if possible, a few hip tilts or gentle stretches. Those small steps prevent pelvic tightness and support a good night's sleep. We should also consider common medical realities after 60 that influence frequency. For people with prostates, mild urinary symptoms like hesitancy, a slower stream, or nocturnal trips are common. In some cases, gentle self-stimulation can temporarily relax the pelvic floor and improve the sense of release. In other cases, especially if the pelvic floor is already overactive, frequent stimulation without adequate lubrication or warm-up can increase next-day sensitivity. If you notice heaviness between the sit bones after a session, lengthen the rest interval and emphasize breath and heat before your next session. For people who have undergone prostate surgery or radiation, nerves and tissues may be more sensitive. In that case, reduce frequency, shorten sessions, rely on warmth and lubrication, and place comfort ahead of goal-driven stimulation. Medications matter as well. Many blood pressure drugs, antidepressants, and medications for enlarged prostate can affect arousal, sensation, or climax. That doesn't mean you should stop them. It means you adjust expectations and timing. If a medication leaves you sleepy at night, a daytime session might feel better. If a medication delays climax, consider lowering intensity and extending the warm-up, or separating arousal from climax on some days, so your nervous system can enjoy the calming phase without aiming for a finish every time. Frequency is not just the count of climaxes, it's your overall rhythm of arousal, comfort, and rest. Hydration and sleep set the stage for what feels healthy. Drink more fluids earlier in the day, taper after mid-afternoon, and give yourself a 2-hour window between your last large drink and bedtime. Choose an earlier dinner, lighter on heavy fats and simple sugars. A calm digestive system and a not-too-full bladder improve the odds that a nighttime session supports sleep instead of waking you later. If you're waking twice or more nightly to urinate, consider moving self-stimulation away from bedtime to late afternoon or early evening and observe whether sleep consolidates. Now I want to speak directly to men and women who carry guilt or shame about this topic. After 60, your intimate life, solo or shared, is part of your overall wellness. Self-stimulation is a private practice that can lower stress, maintain tissue health, support circulation, and nurture a positive relationship with your body. Healthy frequency is the one that supports those benefits without leaving you sore, irritable, or fatigued. That means some weeks you may choose less, some weeks more, and many weeks none at all. Your worth is not measured by numbers. Your health is measured by how you feel, how you function, and how you treat yourself. Let's look at 3 brief stories that illustrate how frequency adapts to real lives. Martin, age 67, retired recently and began walking most mornings. He felt comfortable with self-stimulation twice weekly, but sometimes noticed a heavy pelvic sensation afterward. He added 5 minutes of warm compress over his lower abdomen before beginning and slowed his breathing. The heaviness disappeared, and he kept the same frequency without discomfort. Not a dramatic change, just intelligent preparation. Anna, age 72, had avoided self-stimulation for years and believed it was not for her age. Encouraged to listen to her body, she tried once every 10 days with a generous amount of lubrication and no expectations. She slept better on those nights and felt calmer the next day. Her healthy frequency remained low, but meaningful for her sleep and mood. Robert, age 75, takes a blood pressure medication that delays climax. He shifted his sessions to late afternoon, accepted that climax might not happen every time, and noticed his evening was calmer, with no frustration. His healthy frequency changed from counting finishes to respecting the ritual of relaxation. You may be wondering about the supposed risks you've heard about. There are persistent myths that frequent self-stimulation causes enlarged prostate, erectile issues, or nerve damage. In balanced routines with adequate lubrication and recovery, those outcomes are not supported by the evidence. By contrast, the more realistic risks in later life are skin irritation from friction without lubrication, pelvic floor tightness from bracing or rushing, and sleep disruption if stimulation happens too close to bedtime or when the bladder is full. Each of those is fixable with technique and timing. Use lubrication, breathe slowly, avoid tensing the abdomen, and choose your timing wisely. If you live with chronic conditions, fine-tune your approach. Diabetes can affect sensation and healing, so use extra lubrication, avoid aggressive friction, and keep sessions shorter, observing skin carefully. Arthritis can limit hand mobility. Consider ergonomic aids that reduce strain and prioritize comfortable positions that support your wrists and shoulders. Cardiovascular disease requires realistic pacing. Keep intensity moderate and listen to breath. If you experience chest pain, unusual shortness of breath, or lightheadedness, stop and speak with your clinician. If you're recovering from surgery or a medical procedure, ask when it's safe to resume any intimate activity. Healing time matters. Let's return to the central question and reduce it to a practical decision tree you can remember. First, do you desire it, or does your body call for rest? If you feel genuinely tired, choose rest. Health includes saying no. If desire is present and your last session was more than 48 hours ago, and your 4 markers, pelvic comfort, urination ease, last night's sleep, and current mood, are stable, a session is reasonable. Second, will you be able to hydrate earlier and keep bedtime calm afterward? If yes, proceed with the 3-part warm-up: breath, posture, warmth, and lubrication. Third, after the session, check those markers within a day. If 3 or 4 are positive, your frequency is healthy. If 2 or more are negative, reduce frequency or shorten the session next time, and add more warm-up or choose a different time of day. Repeat that loop for 2 weeks, then reassess. For those who like structure, here is a 4-week frequency plan that respects recovery. Week 1. Choose once per week, with the full warm-up and an early evening schedule. Track your 4 markers in a small notebook. Week 2. If markers were positive, increase to twice per week with at least 2 rest days between. If markers were mixed, remain at once weekly and adjust timing. Week 3. If you felt great at twice weekly, try 3 times with shorter sessions. If you felt only okay, stay at twice and maintain excellent preparation. Week 4. Settle on the frequency that gives you the most days of comfort and stable sleep, and keep that as your default. You can always flex down during a stressful week or illness and flex up when energy is high. Partners sometimes worry that solo activity will replace shared intimacy. In later life, the opposite is often true when communication is kind. Self-stimulation can reduce pressure, teach you what feels comfortable, and make shared moments more relaxed and affectionate. If you have a partner, a simple conversation helps. Share that you're exploring a healthy routine for your body and sleep, and invite understanding. Intimacy is bigger than any single act. It's the climate of respect in your relationship. A word about spirituality and personal values. Many people were taught messages that made them feel conflicted about self-stimulation. If that's you, your healthy frequency might be lower, or your practice might take the form of breath and warmth without climax. You get to choose a path that aligns with your values and still supports your health. No script can replace your inner sense of integrity. Let that guide you. Let's touch briefly on the pelvic floor, because it's central to comfort after 60. The pelvic floor is a sling of muscles that supports the organs of the pelvis. If those muscles are too tight, you may notice urgency, hesitancy, or a sense of incomplete release. If they're too lax, you may notice leakage or a heavy feeling. Self-stimulation can either calm or irritate this system depending on breath and tension. To encourage relaxation, exhale longer than you inhale, and imagine the pelvic floor widening and softening on each exhale. If you tend to brace the abdomen, consciously soften the belly and allow the ribs to move. These small adjustments often determine whether a frequency feels healthy. Now I'll answer a few precise questions in clear sentences. Can masturbation be healthy at any age after 60? Yes, when done with comfort, lubrication, and respect for recovery. Is there a number that's too high? If your sessions leave you sore, mentally foggy, sleep disrupted, or emotionally flat the next day, your number is too high for now. Reduce frequency or intensity and reassess. Is there a number that's too low? If you feel stagnant, tense in the pelvis, or anxious about touch, experimenting with a gentle, low frequency once every 7 to 10 days may help your body relearn safety and softness. Does climax have to happen for health benefits? Number. The calming, circulation-supporting effects of arousal and warmth appear even without climax. Many people choose to separate arousal from climax on some days to keep their system balanced. With all of this in mind, here's a single practical guideline you can remember without a chart. Your healthy frequency after 60 is the one that your next day body thanks you for. If tomorrow's pelvis is comfortable, tomorrow's mood is steady, and tonight's sleep is good, your rhythm is right. Keep doing that. If not, change one small variable at a time. Timing, warm-up, lubrication, duration, or the spacing between sessions until your body gives you a yes. Before we close, I want to offer a gentle encouragement. Your intimate health in later life is not a test to pass. It's a relationship to tend. Speak to your body with patience. Give it warmth, breath, and time. Choose frequencies that honor how you actually feel, not how you think you should be. If you need a season of less, that's wisdom. If you find a rhythm of more that keeps you well, that's wisdom too. Trust the feedback of your lived experience. If this conversation gave you clarity, take one small step tonight. Decide your baseline for the next 2 weeks and write down your 4 markers so you can notice real patterns instead of guessing. If you have a friend who would benefit from calm, respectful guidance on this topic, share this message. And if you want more science-aware, shame-free conversations about intimate wellness in the later decades of life, subscribe so we can keep building a community that treats aging with the dignity it deserves.